now we can get into the weeds about what makes a terminal disease. Sometimes when we think terminal, well, does that mean I'm going to die from it? Well, some people with COPD will die from it. Some will die from something else. Some will die from a complication of COPD. Some will die for something completely unrelated. But if the question about a terminal disease is, gosh, does it have a cure? And is it potentially life-threatening? Well, the answer is certainly it's a terminal disease because there's no cure. It certainly can take people's lives. So in that sense, it pretty clearly is a terminal disease, although not all patients will die from it because it tends to be slowly progressive as opposed to rapidly progressive, was what we sort of think about with the classic terminal disease, something like lung cancer. But the fact that even among healthcare providers, we're not exactly sure how to think about COPD. We can imagine how hard that makes it to talk to our patients and families about how severe COPD is, or perhaps that it is a terminal disease. And where that gets us is there's a clear physician-patient disconnect where most physicians do not discuss prognosis with their COPD patients. For one, because no one really knows what the prognosis is, and also it's just hard to talk about this stuff. But most of the data we have does clearly show that COPD patients who are engaged in their treatment enough, for example, to be doing pulmonary rehab, most patients really want information about prognosis. Now, prognosis doesn't necessarily mean how much time you have to live, like weeks, months, or years, but prognosis can really just be about what to expect. What is the future going to look like? For a lot of patients and families, thinking about what to expect and thinking about some of the pitfalls that may come down in the future, potentially including dying from the disease, can of course be scary and threatening, but for a lot of patients, it can be really empowering as well. So let's highlight this disconnect, which tells us that we all need to do a better job thinking about this amongst ourselves and talking to our patients about it. So these are the kind of graphs that we draw in palliative care. We can't do fancy stuff, but very basic. We have function, maybe, which is sort of health, right? And then time. Now, most of us, we want that. We want to be born with very good health, and we want to die with very good health. Most of us don't get that. So let's look at the trajectory of a sort of a classic incurable illness like cancer. Maybe you start out with good health, but then the disease takes its toll and people die in a relatively short amount of time. Now let's look about an incurable illness like COPD, which has a much different trajectory. In general, there's a sort of gradual decline rather than a rapid decline leading to death. But what we actually see, it's even more complicated than this. This is kind of what it tends to look like. There's a gradual decline, which is punctuated by what are acute exacerbations of the disease. Patients could be doing well for quite some time, or maybe have a gradual decline, and then they have an exacerbation that might just lead them into the doctor's office to get steroids and nebulizer treatments and all this stuff, or it could land them in the hospital, or it could land them in the ICU, or the exacerbation could result in their death. But it's really hard to predict ahead of time how severe an exacerbation will be. And also how well a patient will recover from that exacerbation. You can notice here on the screen that in general, after exacerbations, patients don't really recover to the level of function and health that they were at before. Sometimes they do, but frequently they don't. And you can see this makes it even much harder to sort of counsel patients on what to expect when we don't know how severe the exacerbation will be. We don't know how long the time frame will be between exacerbations. We don't know how well they'll recover. And we just have no way of predicting when that final exacerbation will be that results in their death. And that makes it complicated to talk about the types of treatments and supports, like life support, that someone might want to try to forestall that final episode that leads to their death.